This silent infection could be hurting your fertility. You might feel perfectly fine. No pain, no fever, no unusual discharge, but there's a silent infection that could be quietly damaging your fertility right now. And most people have no idea. In this video, I'll explain what this infection is, how it affects your reproductive system, why symptoms often go unnoticed, and what to do about it before it's too late. This infection I'm talking about is none other than chlamydia. Now, before you click away thinking this doesn't apply to you, hear me out. Chlamydia is the most commonly reported bacterial sexually transmitted infection in the whole world. In many countries, especially in women under 25 years old, it's alarmingly common, and most of the time, it has no symptoms at all. That's why we call it the silent infection. How does chlamydia impact your fertility? If chlamydia is left untreated, it can travel from the cervix up through the uterus and into the fallopian tubes, causing something called pelvic inflammatory disease. It's popularly just called PID. Now, this is where the real damage happens. PID, pelvic inflammatory disease, what it does is it can scar the fallopian tubes, it can block the tubes entirely, as in it prevents the egg and the sperm from meeting each other, and it prevents fertilization, or it even increases the risk of ectopic pregnancy, where the fertilized egg implants outside the uterus, usually in a fallopian tube. And here's what happens, here's what makes it even more serious. You don't need multiple infections. Even just one untreated episode of chlamydia can cause lasting damage. So, why don't people know they have it? This is the reason, because about 70 to 80% of women with chlamydia, they have no symptoms. No itching, no burning, no unusual discharge, nothing. It can sit there quietly, spreading and causing inflammation and damage while you go about your life thinking that everything is fine. But in men, chlamydia is usually also not symptomatic, that is, no symptom at all. But if they do have symptoms, they might include burning during urination or discharge from the penis. But again, many don't know they are infected, and that means that they can unknowingly pass it on. What about testing? The good news is chlamydia is easy to test for. All it takes is a urine sample or a simple vaginal swab. No painful procedures. And if it's caught early, it's very easy to treat with antibiotics. But the key is you have to get tested. You cannot rely on symptoms alone to tell you something is wrong. So, who should be tested? According to most guidelines, anyone under 25 years old who is sexually active should get tested once every year. And if you're over 25, but you have a new partner or multiple sexual partners, or a partner who might have other partners, you should get tested too. And if you're trying to conceive and you haven't had a recent screening, it's smart to get one now. A simple test today could save you from months and months or years and years of unexplained infertility later. Can you still get pregnant after chlamydia? Yes, absolutely. Many people do get pregnant after a diagnosis of chlamydia, but the longer the infection is left untreated, the greater the chances of damage. And once scarring happens, scarring of the tubes, it can be permanent. So in some cases, women who have had undiagnosed PID may never know until they start trying to conceive, and then they find out that their tubes are blocked. That's why prevention and early testing are everything. What about your partner? If you test positive, your partner needs to be treated too, even if they feel fine. Otherwise, they can reinfect you and then you end up in a frustrated cycle. This is called partner notification and treatment, and it's a very important part of breaking the chain. What if you already had chlamydia in the past? If you were treated early and you didn't have PID, your fertility may be completely fine. But if you've had multiple infections or you've had PID symptoms in the past, like pelvic pain, painful sex, or fever, it's worth talking to your fertility specialist or getting HSG, hysterosalpingogram, which is a type of x-ray that is done to check if your fallopian tubes are open. Can you prevent it? Can you prevent chlamydia? Yes, by using condoms consistently, especially if you are not in a monogamous relationship. So getting tested between partners is a way to prevent chlamydia infection by not assuming that someone is STI free because they seem clean. Chlamydia does not show on the outside. And if you're trying to conceive, both of you, like both you and your partner, should get full preconception STI screening. What I want you to take away from this video is chlamydia is common, chlamydia is silent, chlamydia is treatable. It can seriously affect fertility by damaging your fallopian tubes, and you may not have any symptoms, and that's the most dangerous part. So routine testing for chlamydia is simple, it's fast, and it's life-changing if it's caught early, you know. Both partners should be treated to avoid reinfection. And if you have been trying to conceive and haven't had an STI screening, or you had a history of chlamydia in the past and you're unsure how it has affected you, now is the time to check. Your fertility is too important for you to leave it to chance. And if this video has helped you, please give it a thumbs up, subscribe for more easy to understand women's health content, and let me know in the comment section where you're watching from. Remember, knowledge is power, especially when it comes to your body. Thanks for watching, and see you in my next video.